Should I read the disclaimer?
Yes. Yes.
Hello, everyone. Welcome to our Providence Facebook Live. I'm your host, Mary Renoff. Before we get started, I want to give you a quick disclaimer. As a reminder, the information provided during this event is for information purposes only. If you have any questions around COVID-19, please visit our website at coronavirus.providence.org for official medical updates. This event does not create a doctor-patient relationship, and any questions or medical advice discussed in this conversation is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. So let's get started today by welcoming our guest, Sarah Basie, who's the Chief Digital Strategy and Business Development Officer at Providence, and Miriam Golami, Chief Product Officer at Digital Innovations and Head of Product Design and Software Engineering for Providence. So ladies, let's get started by learning a little bit about yourself. Sarah, would you like to give us a quick introduction?
Sure. Thank you, Mary, and thank you all for joining us. So we are, Miriam and I are both part of the Digital Innovation Group at Providence. And the Digital Innovation Group, just by way of a bit of context, is a group of 3 different pillars. And I'll start just giving you a little bit of overview of each one, and then I'll tell you a little bit about myself. We have 3 different pillars, the first being digital, and that's where we essentially digitally enable our consumer-facing front end for the organization using technology. And that's where Miriam and I are both sort of situated within the organization. The second pillar is marketing. And so all of our organizational marketing efforts that help our customers know who we are, know our brand, let patients, sort of communicate the value that we can bring to our patients and our communities through marketing is the second pillar. And then the third is Providence Ventures. And Providence Ventures is our investment fund where we make investments in healthcare IT, tech-enabled services, digital health companies, and to some extent medical device companies as well. Within that digital bucket where Miriam and I are located, we essentially identify the highest priority problems of the organization in terms of how we're trying to deliver on the quadruple aim for our system and for our communities. We prioritize them and then do really deep build buy analyses on how we can solve them. And if we build, that is what happens with Miriam's team, and she'll tell you a little bit more about that. And if we build, we actually build new companies in addition to new products, as well as new products. So, so we are now building our third company that we'll be spinning out, and we're very excited about it. We'll tell you a little bit more about it throughout this conversation. And my role involved in all this is sort of trying to, make some sense of how we prioritize, what problems we want to focus on, and then how we build those companies to support that.
Oh, that's great. You guys do so much. I absolutely love hearing all the great work that you guys do all the time. So, Miriam, can you tell us a little bit about what your role is?
Sure. I lead product development for digital innovation team. Basically, my team consists of software engineers, product managers, product designers, technical program managers, user research. We have a product operations who helps actually deploy and deliver the software to our customers. So any functionality that's needed to build and deliver a successful digital product is within my organization. It's a small team, it's about 100 people, but they're all very passionate about healthcare, and their background is either tech startups or actually companies like Amazon, Microsoft, where they really wanted to work on something meaningful within an organization that can make that happen. So they're here. And then what we're focusing on, as Sarah mentioned, is to bring access, convenience, and affordability to healthcare for our consumers, but also along the way, as we build those digital solutions, making sure that we are simplifying the caregiving for our patients. Something that Sarah mentioned that resonates with me very much is we don't just build for Providence. Our goal is to build solutions that are scalable. And once we actually work with the different various teams within Providence, with our clinicians, clinical ops team, marketing, with our legal and risk, to make sure that privacy and security of information is there. And with many other pieces of the organization, we build what we call an MVP, minimal viable product. We deploy that, and once it's working well, then Sarah's team has built an awesome partnership with all these health systems and entities. We actually make that the software available to them. And the reason that I'm emphasizing that is that there is a difference between building an MVP versus actually making that scalable and commercializing it to other entities. So that's my team.
What fun. What great fun. Well, I know that you guys have been working on a lot of different technical innovations over the last few years, and that when COVID came to be, it kind of escalated things, and you had to rush a few things, and you actually were able to pull people together and get things going. So could you talk a little bit about how we're using technology to quote unquote combat the pandemic?
Sure, Mary. There's so many different pieces of technologies that have been all working together to deal with the COVID crisis. A few that we were actually working on pre-COVID, and we just repurposed it for the COVID, are Grace, our chatbot assistant, that I will talk a little bit more about, the on-demand virtual visit solution, which is part of our DexCare platform, which is the same day care platform. I'll talk about that as well. And then also the ability to schedule and make the appointments and the care that we have available through Google and other platforms. So let me start, maybe talk about Grace, our chatbot.
Before you get started, you have to tell us why it's called Grace.
Because Grace is such a lovely name. Actually, we are our organization, a big part of it is Catholic health system organization, and Grace is a beautiful name. Personally, I come from a different backgrounds, but I just love the word. Additionally, Mary, I told you that we have a user research team. We actually do tons of user research, interact with consumers and others to make sure that whatever we build or name resonates with them. And so far that has been working. So about a couple of years ago, we started working on a solution that's conversational and also can help patients ease their way throughout their journey. So for example, many consumers, you start with some conditions or problems and you don't know where to go. You have questions and there's a need to answer those and help you navigate. Now, of course, we have our caregivers who do that, but that's not always scalable. And additionally, there's always a waiting time associated with it. So the idea was that we build a solution that uses natural language processing, NLP, and also other types of algorithms and intelligence to help navigate patients to the right modality of care. So for example, we use signals such as your location, the symptoms we ask you about yours, and I say we is really Grace, it's not me. Grace uses your location, the time of the day, the symptoms that you give, other signals, the appointment inventory that we have in the capacity that we have in our system to navigate you to the right modality of care. Or you may have questions about our clinics, about our services. Grace answers those questions. So we had worked very closely with our ambulatory care network team on this platform, DexCare, which is a same day care platform. The idea is that if you have a condition, we can connect you with a provider as easily as and as conveniently as possible based on your conditions and needs. So for example, you could go to a clinic nearby if your location is convenient, or if based on your the scope of services that we have on your symptoms, we could let you connect with a provider through video, or you could summon a doctor to come to your home. So the platform was built for that. Now, for this platform, we brought Grace, who can actually converse with consumers and help them choose the modality of care, and additionally answer any questions. So early in hello?
Oh, continue.
Yeah, sorry. So early in March, I got a call, it was actually a weekend, from our clinical team saying that the situation with COVID is not good. So there are many patients who have anxiety. They may have symptoms or they may not have symptoms, but they have anxiety. They want to know, do they have COVID? What should they do? And then additionally, we had started closing our clinics for social distancing and other reasons. So there was a need to serve all these patients as quickly as possible and make sure that we send the patients who have the most amount of needs to our clinician. So we partnered with them to build another piece of Grace's brain targeted for COVID-19. And in order to do that, actually, we needed to build something fast. We had started talking to Microsoft around September time to bring a scalable natural language processing platform where on top of that, we can bring all our algorithms and intelligence and language models and develop further. When this happened, I was looking for a tool that we can very quickly iterate on, and a team that can actually partner with us closely, fast. And Microsoft team, Microsoft HealthBot team, Azure team, actually a few team in that organization, we all got together. We were talking on a daily basis, and we managed to put the minimal viable the MVP version of the product in about 3 days. So it was it was a lot of hours of work, and to the point that Mary, at some point I was worried about my team, and I was asking them, please go sleep and rest. But we wanted to get this out as quickly as possible. And the reason we could do that is due to investments we had made previously. So the team was already familiar with this type of technologies. And then we were looking for answering patients' questions as quickly as possible. So we actually we have a question and answer. When you ask a question, we use natural language processing to understand your intent and then match that with the answers, question and answers that we have in our language models. And for that, we have been using content from CDC and some of the content that our own clinicians have provided. I know it's a long answer, but it was the first technology that we got out to serve COVID-19 in a very fast, rapid way. So
are there bots that other people would maybe be familiar with? I mean, I know that I use the Alaska Airlines bot a lot, and I know that there's banking bots out there. Is it fairly similar? Is that what our consumers would expect to see?
Yeah, there are actually, so the chatbots that do customer service and other types of solutions have been out there for a long time. Now, I will tell you that natural language processing has improved quite a bit. And it is still, even though it has improved quite a bit, I would say it is still in its earliest stages, and there is so much to do. So you are right that you can use them for booking flights. You can also now use, if you do Amazon shopping and you have problems, you see that a bot very beautifully actually answers your question. And recently I was pleasantly surprised that was able to fully address my concern without connecting me with a customer service person, and it was fast and quick and phenomenal. And that's where we want to make sure we take our consumers. What's challenging about healthcare compared to those solutions is that it has to be HIPAA compliant. We are dealing with patients' lives. We have to make sure it works. And then our body, our mind is so complex that for various scenarios, there is so much involved. I have folks that are coming from technology, they're starting in my team, working on healthcare, and they go crazy in about 6 months, just dealing with the amount of complexity, how much you need to understand about healthcare itself, how much you need to understand about human body, and how much you need to understand about the technology, privacy, security. And what's phenomenal about Digital Innovation Team is that we are embedded in an organization that's been super supportive, and we can collaborate with various parts of the organization that helps us build these solutions quickly.
I know that when you use Grace and you use the bot, that sometimes the next level or the next step in your journey is actually to do a telehealth visit. And that's another thing that you guys was already out there, but you've kind of escalated the way it's used and the number of providers. Can you talk a little bit about that?
Absolutely. So you're right. As part of our Dexcare same day care platform, we had this on-demand virtual visit solution. And in the months of March, to just give you an idea, Mary, we served more patients in a period of 20 days than we had served in the entire 2019. So it was that crazy, the demand for it. So when you think about the bot triages patients in various ways. So it may assess that you need to be monitored, or you may need to connect with a doctor right away. You may need to get tested, but even for that, you need to get connected with a provider. So what we do is that at the end of the flow, we recommend, if you need to do a virtual visit, we recommend you do a virtual visit. You may already have a provider, and it's okay. You can also connect with your provider. So with a primary care doctor that, for example, you already have a relationship with. So there are two types of telehealth solutions to consider here. One is that on demand. I want to talk to a doctor now. And that's the solution that we had built as part of our same day care platform. We actually developed the video solution on top of something called, it's an open source platform called WebRTC. And when I talk about a video, virtual or video solution, a lot of people think about the video audio part of it, but actually there is much more involved. So think about how do consumers find that solution? That's one piece. But then when you actually want to connect with a doctor, initially you and I enter a waiting room. It's like a virtual waiting room. So what should be the experience for that consumer and for the provider? How do we greet them in that virtual world? And then if there's a long queue, which by the way, we got to a point that we had for on-demand visit, we had like 300 people lining up in queue. So we were working hard on making sure that the technology can manage the queue well and can optimize the routing of the patients. But then our clinicians were also working hard on increasing their capacity. And then there is the other type of virtual visit where you go, you know what, I want to connect with my own doctor and I want it to be scheduled. So we actually have built a platform that allows you to schedule visits with your providers, be it primary care or a specialty. And when I say it allows you to schedule a visit, it's not just about the scheduling part of it. That seems simple. It's about from the time somebody starts from Google or Bing and says, I have a problem from these search engines or from other entry points, how do we navigate the patient to the care capacity that we have? So the platform that we built for scheduling, actually, it can expose its inventory through Google, Bing, and other parts of and other mediums. And we work very closely with our digital marketing team on that. And then you can book an appointment. Currently, our team is actually working on integrating that scheduling solution with a virtual solution and making sure our providers and our consumers have a very smooth experience. I will tell you one last piece that my team is working on, which is very, very important, especially for us as a health system and provider. So you had a visit with me, but I want to keep in touch. We need to make sure provider and patient keep in touch. So we are currently working on our patient engagement platform. I work very closely with Sarah's team on understanding that space and the different pieces that need to come together. The patient engagement platform today, what we have is our Health Connect mobile apps, which allows you to, once you complete your visit, you can actually then get access to your health records through MyChart and some of our EMR integrations, but you can also easily access same-day care. We are working on, our chatbot, the assessment bot is also available. And then we are working on bringing other tools, which Sarah will talk about them shortly, but mental health and a few other things that make sure that as a patient, we are going to keep in touch with you and take care of you throughout your journey.
Well, I personally have used the virtual visit and I used the chatbot, and it's a great experience. And actually the waiting room is even a great experience. And there's a chatbot within the waiting room for my virtual visit, which I thought was great. We've gotten a few questions. We've had a couple of people ask us how you access Grace and how you access virtual care. And I know right now you can do it directly through coronavirus.providence.org, but typically where would they go?
Sure. I think coronavirus.org, the website that we have, the microsite that we have put together, is a great entry point. But also you can download Providence or Swedish Health Connect apps They're available in App Store. And if you download those, even if you haven't been our patient, you can easily create an account and you can engage with the assessment bot. And through there, you can also do a on-demand virtual visits. I want to tell you a little bit more, but it's not ready yet. So stay tuned.
Okay.
There are many other organizations who are interested in bringing the assessment bot to their platforms. Some of the organizations our team had already partnered with, the Washington health organization here. Even CDC actually points to our chatbot, depending on the state you are in. But there is a platform that serves many consumers out there that's working with us closely right now, and the solution might be.
I feel like what I hear you saying is you're going to come back in a couple of weeks to do another interview.
You got it. You got it. We are working on any platform where helps us nationally or even globally serve our consumers. And the word has been out there. We were the first, we built the first assessment bot in the nation. So we have had a lot of interest, and actually Saurum manages a lot of interest from health system and others in leveraging that solution or our learnings. And then there are big tech companies and platforms that are also.
Well, let's do that. Let's invite Sarah to talk to us a little bit. I know, Sarah, you're working on a lot of different technologies and with a lot of different partners, and you're even working on things around affordable access to healthcare. What could you share with people listening today?
And so apologies for my connectivity issues earlier. So hopefully I don't repeat something that Mariam already talked about. But I'll talk a little bit about sort of the other services that we've put in place to address COVID-related kind of complications, as well as sort of this end-to-end flow that is the home essentially for a lot of the amazing things that Mariam and team have built. So I'll start with that. I'll start with the flow first. And Mariam talked about the pieces, but I'll just give you kind of the end-to-end view. We think that, you know, our goal was to ensure that as many of those folks that Mariam mentioned who are anxious and not really sure what's going on with this whole pandemic, our goal was to have sort of a home and a guided experience for them. So our digital experience team started with essentially just awareness. And it's awareness for anybody, not just existing Providence patients, but anybody who was part of our communities, who wanted to come to our resources. And that's the coronavirus.providence.org microsite. Awareness then connected to assessment, which was the Grace bot with the brain transplant that Mariam referenced. And then Grace then guided folks into the virtual visit experience, which then triaged them into live testing locations. So we've heard a lot about testing, and folks are very aware of a lot of the complications associated with testing. But what we wanted to do was to say, imagine there are tests, and there are certainly some available in certain locations. We want to be able to guide folks to those locations. So where's there's capacity, we want to make sure that patients can go there. And that they've gone through the appropriate steps in advance to ensure that a test is the right thing for them. And so we stood up this live testing sites that, again, Grace can hook folks up into that. And then from there, we can also hook folks up into home monitoring. So imagine if you are waiting for your test results to come back, or if your test result has come back and you are COVID positive, but you don't need to go into a hospital because you're not sick enough. The best place is to be at home and to be monitored at home. And we worked with two really great companies, one which we incubated internally at Providence, and another which is, we've worked with them for several years actually, and they have recently become a part of our portfolio, our venture, Providence Ventures portfolio. Those two companies are called Zelf and Twistle. And Zelf and Twistle worked to deploy an EMR integrated pathway for asking our patients to input their temperature and blood oxygen saturation data 3 times a day. And that data went back to our providers where they could track how our patients were doing according to a dashboard, and it was really nice and scalable. So, so we were able to do home monitoring. We've monitored now about 1,500 patients, and those folks otherwise, would have potentially needed, maybe would have needed to be seen in a less scalable way. But we were able to provide that in a really scalable way through an amazing partnership with our telehealth team. So Zelf and Twistle, they provided this 14-day pathway for our patients who could make sure that they were being taken care of. It continues to reinforce this notion of virtual PPE. So the best kind of PPE is the kind of PPE that's, there are many miles separating us, right? So it reinforced this notion of virtual PPE and scalability for providers who were making sure that our patients were being cared for remotely. So that's one big.
I have to tell you, Sarah, that we actually have people on the stream right now who are using that technology and who are being monitored remotely and are very thankful. So I have to pass that along.
Awesome. I mean, that was to Mariam's point about just the speed with which we were able to do things thanks to all hands on deck and these amazing partnerships. That went from basically no program in place to having one in place within a span of about 4 days. So again, a really, really impressive effort, and just, it was, the coming together of all of our collective best efforts to deliver that. So that's one area, and that's really the end to end. Think about it, all the way awareness to monitoring and everything in between, and that's how we've connected them for folks. Another area which is kind of adjacent to all of this, but equally important, is mental health. So of course, this is an extremely stressful time for folks, and whether it's our caregivers or our patients, it's extremely stressful, and having mental health support is essential to our resilience and just that general feeling that we're supported. So we, and there are a lot of mental health programs throughout Providence. The digital team in particular worked with another partner of ours called Silver Cloud, which is a computerized cognitive behavioral therapy tool. So cognitive behavioral therapy is a strong evidence-based form of therapy that the computerized version actually is just as effective, which is amazing. And we've delivered it now to, we've made it available to all of our caregivers and are working to make it available to all of our patients too. And we have already done so in some of our regions. And it helps with managing depression, anxiety, reinforcing sort of resilience, and helping folks with managing stress in a really chaotic and difficult time. And so that one's just been something else that we thought was absolutely mission critical for folks.
Well, and I know, Sarah, you and Mariam both touched a little bit on the virtual visit, but I also know that we were able to reallocate a lot of physicians who were in clinics when we closed those clinics to virtual care. But the same can be said about behavioral health therapists. You guys actually were able to turn a lot of those from taking patients in clinic to using telepsych, which is another tool you guys have been working on, yes?
Actually, so our behavioral health team made what they call a behavioral health concierge program available to any of our caregivers, which is basically free therapy sessions done via virtual for anybody in any of our employees. And as you can imagine, those free sessions are so important for like frontline caregivers who are dealing with this difficult situation, just like day in, day out, in a way that is just puts a great burden on them.
Well, I know we're almost out of time, so I have to ask each one of you, is there anything I haven't covered that you think people would like to know about? I know, Miriam, you have a lot.
I mean, there is
so much to talk about.
So much to talk about. I think the most important thing is to say that many people, almost everyone, is working together as a community. It's caregivers, our health system, many others to deal with this crisis. And I'm grateful that we can be a small part of it and join the rest of the community. So thank you to everyone and those of you who are also watching this.
So Sarah, I do have one question for you that came in, which is how are we working with other partners? You guys touched a little bit on the Microsoft piece, but we know we're not doing everything by ourselves. What role are our partners playing in allowing us to get out the door quickly?
Well, so I talked about the technology, a couple of the technology companies, like these startups that we're working with to get services out to our caregivers and our patients. And Mariam touched on this, but I would really like to kind of emphasize that it's not just about Providence. Some of the most important partners in all of this have been the other health systems that we've worked with, who we've either just shared learnings with, or we've actually shared technology with to be able to put these products and services in the hands of their communities across the country. In the Midwest, in the middle of all of this, Mariam's team deployed Grace and virtual visits to a partner of ours in the Midwest as they were really ramping up for their sort of surge. So those health systems who are mobilizing and putting these services and technologies in the hands of their patients, I would say are actually some of the most important partners in all of this, because we've come together not as individual health systems, but as a community to serve the community. And that's been, I would say, one of the most important things. So, you know, we're like with Grace, we actually worked with, and we have some other internal partners to an organization called Blue Tree, for instance. We've worked with them to free of charge give Grace to other health systems too, so that their patients could access it on their websites. So it's been, I know we talk a lot about tech partnerships, but really like those health system partnerships have bared a lot of really good fruit for the community throughout this whole thing.
Beautiful. Well, thank you guys for joining us today, and everyone for listening and sending in your questions. To learn more about our initiatives, programs, and services, and ways to give, because we know a lot of people have asked how they can be a part of the solution as well, do visit coronavirus.providence.org. If you're looking for help or medical advice, visit the same website and try taking a chance with Grace, right? Let's give it a whirl. And make sure you follow us on social media at Providence Health System on Facebook and Instagram, and under Providence on Twitter. Thanks, guys.
Thank you. Bye.